Hi, I'm Robin Toller-Hickey. I'm the owner of Rebalance Pilates. I'm a Pilates instructor, a healthy movement coach, and I am certified through the Pink Ribbon program to work safely with women who are recovering from breast cancer. So in this video, we're going to look at some gentle movement and stretches that are appropriate for the first week or two post-surgery. These movements are safe whether you've had a mastectomy or a reconstruction. So after surgery, your incision site is going to feel pretty tender, but it may also feel tight or like the skin is pulling together. And that's going to be due in part to the buildup of the scar tissue that is helping with the healing process. So as the scar tissue builds, it's going to pull the skin together, creating that tightness, and that tightness could affect your range of movement. Our goal is to get you back to your full range of movement, or as full as we can get, that you had before the surgery. And that is going to take some time. We want to make sure that we're keeping the affected tissue or the tissue under the affected arm as kind of open and moving as much as possible in order to counterbalance that tightness that you might feel. So the first exercise that we're going to do is breathing. Why is breathing an exercise? Well, when I take a breath in and out, you can see that the tissue at my ribs expands and releases. So this is especially important considering that we are focusing primarily on tissue under the armpit. And when I breathe into my lungs, into my ribs, that's the exact tissue that is being gently stretched. So even just breath alone is enough of a gentle stretch to access the tissue that will have been affected by the surgery. Finding that breath is also really important for when we get into exercises where if it feels like just the range of movement is not great, and when you do the exercise, you feel like there's some pain or pulling or discomfort, release that, move back to an area where you feel like you're in control of the movement, and then take a couple of breaths, a couple of deep breaths into the tissue from there. That breath will gently massage and manipulate the tissue and open it up so that in time, as it gently releases, through that breath, you'll start to get more and more range of movement. The breath is also really important to help move the lymph fluid through the lymphatic system. So with breast cancer, the lymph nodes can become damaged or they can be removed entirely. And when that happens, the risk for lymphedema increases. Lymphedema is when the fluid can't pump properly through the lymphatic system. It's a buildup of this protein-rich fluid that can pool or create painful swelling in the limbs. So when we take our deep breath in, we call it diaphragmatic breathing. When we take a breath in, the diaphragm flattens, allowing the air to be drawn into the lungs. When we exhale, the diaphragm recoils, pushing the air out of the lungs, effectively changing the pressure within the body, creating a pump system. So that breath is the pump system for that lymphatic fluid, that lymph fluid to move through the lymphatic system. So when we have that great breath down, everything is moving in the body. And so it'll help decrease the risk of lymphedema, and it'll help decrease the risk of that painful swelling. So we want that breath to be nice and active. So we have our breath down. Now what can we do? We're going to start to move the upper body, and we're going to start by doing just gentle shoulder shrugs. So allowing the shoulder blades to just glide up and down the back or up and down the ribs. It's not aggressive. I'm not jamming my shoulders up to my ears. But you can see that as I do this, the tissue under, and I'll just focus on the one arm, the tissue under the affected arm is lengthening and releasing. So I'm getting a bit of a gentle stretch there. From there, I can go into circles, and I'm going to turn on my side so you can see the circles. Nice, easy circles. And what's great about the shoulder circles is it moves the tissue in multiple planes of movement. So when I bring my shoulder forward, I'm getting a bit of a stretch through the tissue in the back. When I bring my shoulder up, I'm getting a stretch under the armpit. And when I bring the shoulder back, I'm getting a stretch through the front of the body, that pec and that tissue there. And you can go the opposite direction. So again, I'm just massaging and moving the tissue in multiple planes of movement. From there, if that is feeling good for the body, we're going to start to add a bit of load onto the affected arm. I'm going to bring my hand to my shoulder. To bring my arm out right away might be too much load from the tissue to handle in that first week. So I'm going to keep the lever short, which is going to be less load for the body. So hand to the shoulder, imagining I've got a little string on my elbow. I'm going to lead with my elbow to come up, only to 90 degrees. In that first week or two, to go past 90 degrees is too much of a stretch for the affected arm. So we keep it at 90 degrees to start. So again, I'm just gently moving the tissue, and I can open the arm out to the side as well, keeping the arm in my peripheral vision. And this out to the side is much more of a stretch for the affected arm. And I can put the two together, opening and closing. So I'm working through multiple planes, working that tissue through multiple planes, and I can add little circles. Now, because I'm not going past 90, the circle might be kind of a flat-topped circle. And the other direction. Now I'm moving quite quickly through these, but you could do about 10 of each of these 3 to 5 times a day, and move on the slower side. So that way you can really feel where that pull of the tissue is, and so that you don't feel like you are going past a point that you feel is safe for your body at that time on that day. If that is feeling good with that amount of load, then try the longer lever after a couple of days. Check in with your doctor. Make sure you're getting the okay to add a longer lever, more load to the shoulder. You always want to be checking in with your doctor, of course, on your recovery. So these are just 4 or 5 exercises that create a foundation to all of the work that we're going to build on after this to help increase your range of movement post-surgery, to help increase your strength post-surgery. So I hope that those help you, and I'll see you again soon. Thanks.